Hi everyone, Nurse Ange-Aimee here. Today I wanted to talk about doing your first home health assessment visit. So we're going to talk about scheduling, consent forms, report sheets, doing the full assessment, and pretty much just everything you're going to do your first visit. So to start, when you get your first patient, your company's going to send you the H&P. So before you do schedule or anything, you're going to look over the H&P, kind of get an idea of what the patient needs. Do they have any wound care, or do they need medication management, things along those lines. So you just kind of look over the patient first. The next thing you're going to do is you're going to schedule. So basically, this phone conversation, sometimes patients don't even know that they're getting home health. They have no idea what's going on. So you need to make sure that first they know why you're calling. So you introduce yourself, say, I'm the nurse with so-and-so company. I'm here to schedule the first assessment for your home health services. And also make sure that they know what it is and how long it's gonna last. So the company should do a good job of doing this before you call, but if not, you might have to do some more explaining to the patient. So if the patient agrees to it, you guys both come up with a date and time. I suggest when you come up with a time, you leave that hour gap and you let them know, just in case the previous patient takes longer, I'll be here between this time and this time. Okay, so you have your scheduled visit. You know what's going on with the patient. You know what supplies they're gonna need, if any. And then you arrive, the day of, you're going to call and remind them, say, my name is so-and-so. I am about to head to your house. Okay, make sure you get that phone call, because if you don't remind them, sometimes they may forget and they might be gone and things along those lines. So just always remind your patients that you are on the way. Okay, so you're on the way now and you finally arrive to the patient's house. Very important. What I like to do, because we deal with so many different types of patients with various backgrounds, I always ask them first, okay, do you want me to keep my shoes on? Kind of make sure you're respecting their house. And that is one big difference between working in the hospital and going to patients' homes, is that everyone has different rules for their home. So I always ask, would you like me to take my shoes off, and things along those lines. Just make sure you're respecting their home. And ask them, okay, where can we sit? One of the great things about working home health, you get to meet the whole family. So it's just very the beginning is greeting them, making sure you're respectful, making sure you place your bag a certain way. I'll do another video on the bag technique, just making sure that, and then also you can wash your hands beforehand, just so they know that you're very respectful of their home and their family environment. That's the first thing. Okay, so when you get in, after the greeting, the first thing you want to do is, before you touch the patient, before anything, you're going to do the consent forms. So most companies have a book already put together where you go over the consent forms, you kind of give them, read over everything so they know what they're signing. Most of it is one, consent to receive treatment in their home, and then others insurance questions, things along those lines. Also, they have a home safety evaluation where you're just gonna kind of look around the house, make sure the house is safe for them. Like an example would be, okay, check out their shower. Do they have a slip mat in there? Do they have grab bars? Or is there any fall risks around the home? Things along those lines. The report sheet pretty much guides you through what to check for in the house. So that's how I like to start off, is consent forms and doing the home safety evaluation. Okay, and then so after you do the consent forms, the next thing would be you should have a report sheet that you go by. This is what you would send to the case manager. So basically it has the vitals, specific things to the patient. Are they diabetic, for instance, things along those lines. And then they have a note section where you can write specific notes geared towards that patient. So that's what I like to do next, is do a full assessment, looking over the patient and writing their vital signs down, and then making any notes. For instance, if they're diabetic, do they check their blood sugars daily? Do they have everything they need to do that? What medications are they taking specifically? Or for instance, if they're on antibiotics, what are they for? When was the start dates? Things along those lines. So the report sheet is really for things that are specific that the follow-up nurse should know. If there's wounds, what supplies do they need for that wound? Things along those lines. If they do have a wound, I also like to address the wound first and look at it, take a picture of it, and kind of suggest wound care. Hopefully in the H&P, the provider has wound care orders, but if not, then you kind of just write your own orders and go from there. So After you're filling out the report sheet, another big thing is looking at all of their medications. You want to make sure none of their medications are expired. You want to write down all the dose and everything, and then answer any questions they may have about their medications or their health in general. And then another big thing about home health, okay, do they need physical therapy? So this is something you can talk to them about. I would always ask first if they want physical therapy. Some patients don't want it, some patients do. So if they say yes, then you mark it on the sheet that that's one of the services that they will be receiving. Do they need wound care? What should the LVN be doing when they follow up, things along those lines. So pretty much that would be the entire visit. Main thing first is getting that consent and just making sure you're doing a full assessment. Sometimes patients don't know what their diagnosis is or anything much about their medical health. So if you're kind of confused about that, you can ask, well, do you have any medical documents in your home? And if they do, you can kind of just skim through things and get a better picture of the patient, just to make sure you don't miss anything. So that's the first assessment visit. In the beginning, it took me a long time to do my assessment visits because I was so worried that I forgot something. But once you get a good system down, it's a lot easier and you'll get a lot faster. So after that, you're going to turn in the report sheet to the case manager, and then they're going to start working on scheduling and things along those lines. And then when you get home, you want to chart on the patient within 2 days of seeing them. So when you get home, you can start charting. Charting in the beginning will take a while because you have to figure out the system. So initially, it probably took me like 45 minutes to chart, but now it takes me about 15 minutes because I know, what things to. Pretty much I know how to chart and I'm used to the system now. And then also I have templates that I can use now for the narrative. So it takes me a lot less time overall to chart. So you see the patient, turn in the report, then you chart. And then every company is different. They might want you to turn in your timesheet, or some companies you do an electronic signature to show the date and the time that you were there at the patient's house. So it really just depends on the company. Those are really things that are different. So let's see, I think that pretty much sums up a first visit. Some things that you want to bring in your bag, definitely you want the blood pressure cuff, anything for their vital signs. You want to have some sanitizer. You want folders to keep the consent forms in. Also, that's another thing. You have to either mail the consent forms to the company or scan them in electronically. If the patient needed any supplies, of course, that's why when you schedule it, you want to see what supplies they're going to need so you can bring those with you. Pens. You definitely want to have your badge on at all times. You don't ever want to go to a patient's house and them not be able to identify you. Really, I think that's pretty much the basics. And then later we can go over the more visits. So like I said, I am new to this. And if you have any feedback or any questions, please let me know. Thank you.